Why CEA tumor marker test alone isn't enough for colon cancer. The Carcinoembryonic Antigen test, or CEA test, is often discussed in the context of colon cancer, but it has limitations that make it insufficient on its own. First, let's talk about sensitivity. In early-stage colon cancer, CEA levels are usually normal. For instance, only about 4% of patients with stage 1 colon cancer show elevated levels of CEA. This means that many early cancers could go undetected if we relying solely on this test. Next, we have the issue of false positives and false negatives. Elevated CEA levels can occur due to non-cancerous conditions, such as smoking or inflammation. This can lead to a false positive result, suggesting cancer when there is none. On the flip side, some cancers do not produce much CEA, which can result in a false negative. So, a low CEA level does not guarantee that cancer is absent, and a high level does not confirm cancer recurrence without further testing. Another important point is that CEA expression can vary from person to person and even from tumor to tumor. Factors like smoking can increase CEA levels, making the results unreliable in certain individuals. Additionally, exposure to animal antigens can lead to the production of antibodies against CEA, further complicating the accuracy of the test. Because of these limitations, the CEA test should not be used in isolation. It is recommended to use it as part of a broader diagnostic strategy. This includes imaging studies, such as computed tomography scans and ultrasounds, as well as colonoscopy and clinical evaluations. Serial measurements of CEA over time can provide more valuable information than a single test. For example, if CEA levels rise after treatment, it may indicate recurrence, but this must be confirmed with imaging and other diagnostic methods. It is also crucial to note that CEA testing is not suitable as a primary screening tool for colon cancer. Its low sensitivity and specificity mean it is more useful for monitoring treatment response and detecting recurrence in patients who have already been diagnosed. Finally, discrepancies can occur between CEA levels and imaging results. In cases of metastatic colon cancer, about 30% of patients may not have elevated CEA levels, even if the disease is progressing. This highlights the need for multiple assessment methods to get a complete picture of a patient's condition. In summary, while the CEA tumor marker test is a helpful tool for monitoring colon cancer, it cannot stand alone for diagnosis or screening. It works best in combination with other diagnostic methods to provide a comprehensive understanding of a patient's cancer status. Always consult with healthcare professionals for personalized medical advice regarding colon cancer and the use of CEA testing.